My name is Selena Jade Brown. My mob is mainly from Far North Queensland, so my mob is Java and Rubble and Bunda in Bunbury. I'm hearing impaired, have been since I was born, and I come from a big family and I work mainly in Katherine, so you're going from Far North Queensland into somewhere very remote like Katherine is a bit of a learning experience for me, but so my background is mostly hospitality, and then I got into health because all of my family have conditions, especially chronic health conditions, so I decided to get into health to sort of help them and also help myself as well, and try and navigate our health, so that we live longer and live better. So I work for Wurli Wurlinjang Health Service in Katherine NT, and I work in a program called the ITC program, which is the Integrated Team Care program. And mainly my job is to go out into client home and deliver like a sort of basic client healthcare in their home. I have a set list of clients and a set criteria for those clients to be in that program. And I also work within other programs within Wurli Wurlinjang, such as the Family Partnership Program, the KISS program, which is the Katherine Independent Support Program, and also Strong Bowel Adjustment, and the Gabinji Chronic Disease Clinic as well. So we all work together within Wurli Wurlinjang and help deliver good healthcare for our clients. So every day is success. I think when we finally have a client that comes into the clinic regularly and they take their medications and they look after their health, that is success for us. So we don't just have one success, we have many, and we celebrate that milestone because we want to make it equal for everyone so that everyone's not left out. I'm very proud of what the ITC program does, as well as the other programs, especially the KIDS program, because the KIDS program, they work with people who are frequent flyers in hospital, and they help, when they get out of the hospital, they make sure that they have somewhere to stay when they're out of the hospital. They make sure they've got a lawyer if they need it. They make sure they've got food hampered. And ITC, my program, helps with the clinical side of things when they get out of the hospital. So we make sure that they're doing okay. They've got everything they need, including equipment. And to us, that is a success. So having a happy client is a success to us. So there's no one success or three success. Every day, seeing a smile on our clients' faces and having them come into the clinic. For me personally, it's having the client come into the clinic and then, they're coming in regularly and then they ring me up and say, I picked up my medication today. You don't need to pick it up for me. So that for me is like, yes, I don't need to do it. So, and if the client comes into the clinic, I've been going in because you keep humbugging me. So yeah, I think when I hear my clients say that, I'm like, okay, so I don't have to worry about her today. I can focus on someone else that doesn't need my care. Yeah. Only that I'm hoping that other states, they take on board the success of having Aboriginal health practitioners, because I think in Queensland we're not recognised at the level, like we're not recognised in the same way that nurses and doctors are. And you could look at the success of NT and WA, like Aboriginal health practitioners and Aboriginal workers and Aboriginal liaison officers. They're held in a high regard because, our mob want to help in that they're more likely to talk to someone who is an Aboriginal health practitioner than they will talk to someone who's a nurse. And I think also our clients, they prefer to talk to us because they feel comfortable around another Aboriginal person or another Indigenous person than they would from some white person who come from overseas and don't know how, or someone who hasn't done cultural awareness training and isn't aware of the issues that goes on in Indigenous communities. So I think if Queensland and New South Wales and all the other states that don't recognise Aboriginal health practitioners and Aboriginal workers, I think if they can get on board and see the success rate, then that would be great, because that means I can go home and work in my own community and instead of having to go somewhere like NT and WA and be away from family. Because that's the reason why I can't go home and work in my own community, because they won't recognise me as a clinician. They'll just recognise me as someone who's done some training, but not at that same level of nurses.
Thank you.